welcome. Thanks for coming in and doing the testimonial today.
Yeah.
Awesome. Okay, so what brought you into our office to begin with?
I work out and was having really bad pain in my knee and subsequently in my wrist from carpal tunnel.
Okay.
But primarily my knee. I was having some pretty bad pains while I was working out. So
Where would you say the pain scale was on 1 to 10? 1 is very mild and 10 severe pain.
at any point in time, while I was working out, it could range anywhere from 5-ish. After I worked out, that pain could radiate up to an 8, 9-ish.
Wow.
It would cause me to limp. So yeah, it was pretty discouraging.
Where would you say the pain is now on that pain scale?
Oh boy, if I push my workout, maybe 2-ish. I mean, that's just, I don't have any of the limping anymore. I am reducing. I haven't gone back to complete working out intensely, but I'm doing squats now that would be very painful before. I can do squats. So I'm slowly building my way back up. The only thing that I haven't really tested completely yet is running. I'm not a big runner, but I don't know that I'm quite to the point yet that I would feel comfortable doing 5 miles. But I'm definitely squatting in my workouts with no pain.
And it's been how long since you've gotten the stem cell injection in the
I
right
just
knee?
went over 6 months on Monday.
That's amazing.
Mm-hmm.
6 months, and about how much percentage would you say better?
Oh, probably 80%.
80%, 6 months.
Yeah.
Thank you very much for that. That's great.
Yeah.
That's a great testimonial. Okay, so what was it like before you had our treatment pain-wise? With your, well, I guess you just answered that more with the activity. Okay, so what made our office and our service stand out from other options?
I seen an advertisement. I really wasn't familiar with stem cell. I kind of had some idea about what it was prior to, but they advertised a seminar and I went. It was Dr. DuPont was giving the ceremony or the seminar, and he impressed me with the research, and so I really didn't check anywhere else. I just kind of felt very comfortable with his knowledge and what he presented at the seminar that I didn't really feel a need to research anywhere else.
All right. What was the best experience about working with our company now that you've been here and you actually came back to get additional cells?
Yeah.
So what would you think what would you state the best experience about working with our company has been?
Darian, the nurse practitioner, she's awesome. She's just very upbeat, makes you feel very comfortable, very knowledgeable about the process. She was very helpful in answering any questions that I might have. That in and of itself, for me, was a big part of this, was her confidence and trusting in this process. I mean, it's a little nerve-wracking. I mean, you're putting a big investment into something that you don't really know if it's going to work. I know the research is out there, but mentally I was wondering, what if this doesn't work? And so it's nice. It's nice to be able to come here and she really put my mind at ease with her knowledge and experience and understanding of the process and the research that has gone into it and the successes that have also occurred.
Good. Well, knowing that you're here additionally now today, it's not obviously for the knee, so we're going into a different area, so that's important that we point that out. So now you're looking for general overall health and an IV push, so we're looking for an IV. Very good. I'm glad to hear that. What have you been able to achieve since having the stem cell therapy and things that you can do now that you could not do before?
Oh, before, and a lot of mine goes back to working out because I try to work out every day, and it's very frustrating. So one of the other areas that I was starting to have some pain in after I had surgery done on my wrist was doing a push-up. Became very painful. I would actually have to shake my wrist out, like halfway through. I'd have to pull up, and just kind of, I have no problem with my wrist. So if you want to say percentage-wise, my wrist is like 100% now. I have no pain in that whatsoever. I had just had a little bit of an injection in my wrist. Most of it went into my knee, but that I would say is hugely successful. So now I do push-ups. I don't have any problem in my wrist. As I said before, sometimes when I would do extensive lunges, squatting, I would definitely very shortly after my workout would have a limp on this right leg. That's very discouraging when you like to work out, to know that you're having problems. And so modern medicine, how can you not want to take advantage of something that could help you improve your quality of life? So
Great
for
answer.
me, it's been well worth the investment.
Awesome. And lastly, what was the main reason you would recommend, or what's the main reason you would recommend our services to others?
I think just that, the quality of life. I mean, I think with modern technology and where we see our lives going, and I want to be healthy, and I've made some bad choices in my earlier years with my weightlifting, and so now knowing that there's something out there that could improve my quality of life, improve my ability to function into my 80s and 90s without that thought of, am I going to have knee replacement? And that's basically where it came down to. My doctor told me flat out, you have two choices. You reduce your working out considerably, you stop running basically, or in the next 5 to 10 years you will be having a knee replacement. And that wasn't an option for me.
Well, that's not good.
No,
Right.
Not for somebody who wants to remain active. And I see how that is with people with knee replacements. My mother has one, my dad has one, and although they're far better than what they were, but their mobility is hugely limited. Getting down on your knees and getting down on the floor and picking things up. So for me, it was a no-brainer at this point in time. I mean, I was nervous coming into this, hugely nervous, because I don't know anybody. I didn't know anybody who had done this. So it's kind of, for me, in the circle of friends that I have, I'm kind of like the guinea pig, if you will. I'm the test pilot, I guess. And so far, I'm extremely happy.
And you're past military as well, so I want to say thank you for your service.
Thank you.
And being active, you want to stay active because of your past military,
Yes.
and that's awesome. So knowing that there's other areas and facilities around that do the stem cells and stem cell treatments, what would set us above, and what has set us above the others that you may have heard of or have seen?
And that's kind of hard because as I said, I didn't research anybody. I was pretty much sold at the seminar by Dr. DuPont.
Okay.
Maybe my brain tells me maybe I should go and research other, but I'm very happy here. Darian is, she's a big part of my experience here, and I trust her. Hopefully she wouldn't lead me astray, and I haven't felt like she did. She's always been very upbeat and open and honest with expectations, and I don't really see a need to go anywhere else.
Well, hopefully you just met me and you now see that I'm also a team member as well, and I'm not going to lead you astray. And I've also gotten the stem cells with great results. So awesome. Thank you so much for your testimonial.
Absolutely.
Do you have anything else to add? You want to add or anything?
No, I would just say it may be nerve-wracking and it is a huge investment, but I'm happy. I'm truly happy, and I'm not one to just throw money away frivolously.
Right, frivolously.
Frivolous. That's a tough word.
That's frivolously, yes.
So yes, I would say I'm happy. I'm very happy with the results thus far.
I call it priceless because knowing that you can take multiple medications and multiple pain meds, anti-inflammatories, muscle relaxers, knowing that without the stem cell or getting the stem cells and without the pain, you're off the drugs.
That's right.
So it's priceless.
It's huge.
So take that one with you. I call it priceless, and I think that's awesome. So thank you so much for your testimonial.
Absolutely. Thank you.
Yes.